Good morning, this is All India Radio Kohima. I am Navin Pradhan with the morning news. The Nagaland government spokesperson for COVID-19 has said the infrastructure installation at the BSL-2 lab in Dimapur is in the final stage of completion and is expected to become functional soon. State spokespersons Minister Niba Krono and Advisor for Information Technology, Science and Technology, Monlumo Kikon, in a briefing yesterday said efforts are being made to augment the COVID-19 capacity in Dimapur and to decongest the COVID-19 hospitals. They said one COVID care center at State Institute of Health and Family Welfare at Chimagadima, to be managed by CIHSR, will be functional by the next 2 days. To augment the capacity of COVID-19 facilities, a 50-bedded COVID-19 hospital has also been operationalized by the Assam Rifles at ARTC Shokuve. To supplement the medical manpower of Dimapur, 5 newly recruited medical officers are being deployed and more manpower will be deputed as and when recruitment to newly created posts of doctors and nurses takes place. The spokespersons said private hospitals are also providing medical manpower in the management of various quarantine centers. Further, many churches, NGOs and volunteers are selflessly rendering non-medical tasks at various quarantine centers in Dimapur. It was informed that 2 more Quattro TrueNAT machines are being provided to Dimapur district in the next few days to further increase its capacity to test. Meanwhile, they appealed to the citizens and civil society organizations of the state to extend their fullest cooperation so that unitedly we overcome the challenges posed by COVID-19. Prime Minister Narendra Modi held a detailed meeting with senior ministers and officials yesterday to review India's response to the COVID-19 pandemic. The meeting reviewed the national level status and preparation in the context of the pandemic. It took stock of the situation in different states and union territories, including Delhi. The meeting was attended by the Home Minister, Health Minister, Principal Secretary to PM, Cabinet Secretary, Health Secretary, ICMR Director General, and other officials of the empowered groups. Dr. Vinod Paul, Niti Aayog member and convener of the empowered group of Medical Emergency Management Plan, made a detailed presentation on the current status and likely scenario of COVID-19 cases in the medium term. The members took note of the fact that out of the total cases in the country, 2/3 are from 5 states. In view of the challenges being faced by the large cities, it was discussed to augment testing as well as the number of beds and services to effectively handle the peak surge of daily cases. The Prime Minister took cognizance of the recommendations of the empowered group on city and district-wise requirements of the hospital and isolation beds. He instructed the Health Ministry officials to undertake emergency planning in consultation with the states and union territories. Nagaland Health and Family Welfare Minister S. Pangnyupom said 27 more patients have tested negative for COVID-19 yesterday. State government spokespersons Minister Niba Krono and Advisor Monlumo Kikon said the number of recovered persons have gone up to 76 as of yesterday, while the total active case is at 87. It was informed that a total of 5,945 samples have been tested, out of which 4,616 samples have been received and 1,329 samples are awaited. A total of 6,774 persons are presently under facility quarantine and 1,775 persons are under home quarantine. In Mon, the district administration has activated the COVID care center for the treatment of asymptomatic positive patients. In this connection and in the interest of public health and public order, Mon Deputy Commissioner Thava Silan K has prohibited movement of public within 1 kilometer radius of the containment zone Wangkhao Government College campus and the adjoining ITI campus. This order comes into force with immediate effect and shall remain in force till further orders. The order said anyone violating the aforesaid order will be liable for punishment under Section 188 of the Indian Penal Code. The citizens of Mon District have been requested not to panic and have been assured that the District Task Force and the empowered group of Mon District are taking all possible measures to ensure containment of cases and speedy recovery of positive cases. And that's all the news we have for you this morning. Have a nice day.